Good afternoon and welcome to the City of Toronto's COVID-19 media briefing for Monday, October the 26th, 2020. Joining us today is Mayor John Tory, Toronto's Medical Officer of Health, Dr. Eileen, and Toronto Fire Chief and General Manager of the Office of Emergency Management, Matthew Pegg. Mayor Tory.
Well, Brad, thank you and good afternoon. I spent a great deal of time over the weekend talking to Dr. Davila, but also to other health experts, to business leaders, and to several trusted friends. All of those conversations reminded me, yes, of the paramount responsibility that we have to save lives and stop the spread of this terrible virus, but also the responsibility we have to safeguard the well-being of people in a more general sense. Many times in private and here at these briefings, Dr. Davila has indicated her deep professional and personal understanding of the fact that people's overall sense of well-being, their mental state, their employment, their financial situation, and a number of other things are all part of public health. In fact, I've learned that concept from her. As we have been saying, as I've been saying quite frequently, a healthy economy requires healthy people, but for that matter, healthy people require a healthy economy. All of that is part of the incredibly difficult balancing act we must all do continuously, daily, in making what are complex decisions about a virus about which we still know so little when it comes to fighting it and to eradicating it. Governments around the world have been confronting this challenge. As we are doing here, most of them are also working to constantly recalibrate that balance as time passes and as circumstances change. Many, if not most, have implemented public health measures very similar to what has been done here in Toronto and in parts of the GTA. In that regard, you may recall that I asked Dr. Davila at the beginning of the 28-day pause, the return to a modified Stage 2, if she would work with her staff to prepare some post-28-day scenarios, which, if circumstances permit, we would have ready to implement right away. We would obviously have to agree on these with provincial officials in most cases, since it is their order which is now in effect. And in this regard, I have also spoken to the Premier about the work we are both doing on a post-Stage 2 plan. While Dr. Davila and her team will be bringing whatever reflects their best professional advice, I have asked her to make sure that at least one scenario sees us reopen at that time, reopen those institutions and establishments that are closed, but with whatever conditions are necessary to do so safely, and ideally to remain open thereafter. While there was great debate about it at the time, I think that was the central objective in reopening the schools. Do it, but do everything possible to do it safely and with a view to keeping the schools open. And I think thus far that has been working quite well. We need a safe and more certain path forward for restaurants and other business establishments. Once these scenarios have been put forward by Dr. Davila and her team, we will discuss them with the province and obtain feedback from some of those who would be directly affected. I am, of course, not able to say today whether we will be in a position to adopt these kinds of scenarios on day 29, but I am determined to work with the medical officer, with the province, to see that we have them ready. And I am extremely hopeful that as part of the constant re-examination we must do of the overall impact of the virus, the measures we are taking to fight it, the effectiveness of those measures, and other impacts they are having on people and business, that we will, as part of that exercise, be in a position to implement these kinds of scenarios. I also mentioned in my conversations with Dr. Davila on this matter that we will all have to discuss enforcement. I'm mindful of the success we have on an ongoing basis with prohibitions in restaurants on things like smoking and underage drinking, just to cite two examples. And I'm sure there's some learning in that for all of us. I will no doubt have more to say about this in the coming days, and I'm looking forward to working with Dr. Davila, as we have so well throughout, with the province and with the community, to make happen this kind of a positive move forward. As we plan for the future of our work to support restaurants through these tough times is continuing. I'm pleased to announce that starting today, more than 1,000 local businesses that have enrolled in Open for Business, the City of Toronto's collaboration with Ritual and DoorDash, those 1,000 local businesses will receive free delivery until November the 8th. As a result of our Open for Business partnership with Toronto-based Ritual, we launched the Ritual One app this spring to help local businesses across Toronto increase their commission-free online sales. Now, during this 2-week promotion, All flat fee delivery charges will be waived for both customers and local businesses to encourage customers to order directly from local businesses. It is thanks to great partners such as Ritual and DoorDash that I am confident Toronto businesses will recover and rebuild from this pandemic stronger than before. And I want to thank these firms for their leadership and generosity. And I want to encourage Toronto residents to take this opportunity to support our local restaurants and food services businesses and place an order on the Ritual One app without incurring any delivery charges for themselves or for the local businesses they are supporting, even more importantly at this time. A list of all participating restaurants is available at ritual.co/GO/TOR04B. And there's an example of what it looks like, and you can look at it by a region as you go along, region of the city, or by a different criteria. As announced earlier this month, Ritual is providing its commission-free digital ordering platform, Ritual One, to Toronto businesses at no cost through to the end of the year as a result of our partnership. And this includes waiving a $99 setup fee and monthly subscription fees, which run around $49 per month. All local businesses that enroll in Ritual One will receive delivery capabilities powered by DoorDash Drive, its fulfillment platform that powers direct delivery for any business. And any business that completes one delivery order on Ritual One, powered by DoorDash Drive, by December 31st will receive Ritual One free through 2021. So Toronto businesses who are interested in this Open for Business program can still enroll at ritual.co/Toronto. I want to thank Councillor Michael Ford for coming forward with a motion which I seconded, calling for a provincial cap on food delivery service fees. Throughout the pandemic, we have been urging food delivery companies to substantially help their restaurant customers so those restaurant customers can stay in business. While some companies like DoorDash and others have stepped up to help in different ways, we've heard from restaurants that more needs to be done right now, and that is why we're advocating to the province for this emergency action. We will continue to do everything we can at the city to help restaurants get through this pandemic. Finally, I would just like to reiterate some comments that I made in Scarborough on Friday. I believe the key to our relative success in dealing with COVID-19 in this city, in this province, and in this country has been the virtual absence to date of partisan rancor and the fact that there has been very excellent cooperation between and among governments and their leaders. The federal government has been a good, responsible, and responsive partner for Toronto, whether it is on help for restaurants, on small businesses, or wage subsidies, or on rapid housing for that matter. So too has the province been a good and reliable partner. We will be making a grave mistake and will diminish our efforts to fight against COVID-19 if we see a significant emergence of division and conflict in our leadership ranks. This is like wartime. Yes, accountability is important, but there is a way to do it which is constructive and where the public get to see what they have a right to see. All leaders working together to keep people healthy and to bring this nightmare to an end as soon as possible in a manner that is as effective as possible. The Canadian way, that's what I call that way of doing things, has been effective so far. Not perfect, but working relatively well. Let's keep moving forward together. And I will now ask Dr. Davila if she can offer her report for today.
Thank you, Mayor Tory, and good afternoon, everyone. Today I'm reporting 300 new COVID-19 cases. 132 people in Toronto are in hospital with COVID-19. And in the week that started October 19th, 16 people died. On behalf of all of us at Toronto Public Health, I extend condolences to all those who have lost friends or loved ones to this virus. The numbers represent the concerns we've been talking about lately with regard to the increase in case counts, the potential risks to people, the potential risks to the healthcare system, and the choices demanded by an infection rate that is heading in the wrong direction. I think it's reasonable to think that part of the surge we're seeing in Toronto is tied to Thanksgiving. It's been 14 days since Thanksgiving Monday. Between October 12th and 25th, we saw 3,907 new COVID-19 cases in our city. Thanksgiving was on the mind of the top medical officer for the state of Illinois last Friday. Thanksgiving in the U.S. is a few weeks away. And in her remarks, Dr. Ezike was reflecting on American Thanksgiving and those who've been lost to COVID-19. At one point, she turned away from the cameras while delivering that day's case and death counts. She turned away, fighting back tears. I understood why, and I still understand why. She is facing the struggle that all medical officers of health are encountering, where the rise in case counts threatens real risk and real harm. I hope by putting it so plainly, you will understand our shared dilemma. So much of what happens in the next few weeks rests with us as individuals. My message is always to ask you to think about what matters to you and how to go about daily life in ways that reflect what matters to you. Because it seems to me the choices we make in daily life are now directly intertwined with COVID-19. The actions I'm asking you to take are simple. The choices I'm asking you to make are hard. That's why everyone is so tired of all this. But the steps for self-protection really do work to make it harder for the virus to spread. COVID-19 needs a host. That's us. To live and replicate, COVID-19 needs to find a home in one of us and then use us to infect another person. Our numbers are high. Right now, we're making it easier for COVID-19 to spread rather than harder. But these numbers in Toronto do not need to be a self-fulfilling prophecy. If we have belief, will, and perseverance. Those are the three things we need right now, because right now, we are choosing what the next few months will look like. We are choosing between a long winter of allowing the virus to do its worst, of trying to wait it out, surrounded by rising infections, and paying the price for it, emotionally, economically, and socially. Or we can choose a winter with us at our best, acting with belief, will, and perseverance. It will still be a long winter. Parts of it will still be hard. But when it's over, it will be something of which we can be proud because we saw the risk for what it was, acted in ways to thwart it, and came out the other side next spring with less suffering than what might have been and ready for a better future. Belief, will, and perseverance. The belief part is what we want. Lower infection rates, less risk, to come through another day in good health because that's one day closer to vaccination and one day closer to living like we want to live. Will. That's acting in ways that reflect your belief in the things that matter to you, the things you want. Will is the steps for self-protection, making a deliberate decision to limit as much as you can your face-to-face contact with the people you don't live with. It's keeping a distance from those you don't live with. It's wearing a mask. It's washing your hands. It's choosing between the things you need to do and the things you want to do. It's choosing to defer what you can in order to limit contact that isn't necessary in times like these. And perseverance. That's making choices that reflect your beliefs every chance you get. It will add up. We are a city of 3 million people. Imagine what would happen if 3 million people made individual choices each day to act in ways to mess with COVID-19. These are the kinds of things we need to believe in. Now, you will have your own individual reasons. I urge you to take some time to think about them, to remind yourself what's really important to you. Because when you know why you're doing something, it gets a whole lot easier to do it to great effect. I urge you to talk to the people you care about the most. Take a moment and talk with one another about your expectations, your aspirations, your intentions for the next few months. What matters to you? Who matters to you? And what would you give anything to protect? What are you willing to do in the months ahead to protect yourselves? What can you adjust? What can you give up or defer? How do you make the best of the months that take us to where we all want to be next year? What we're seeing elsewhere need not happen here, but it could without your commitment to stop it from happening. The rising numbers in Toronto do not need to be a self-fulfilling prophecy. There is always, always, always the opportunity to turn them back. You do that with every choice you make that puts time and distance between you and COVID-19. Let's show COVID-19 what can be done. With that, I'll now turn it over to Chief Pegg for his remarks.
Excuse me. Thank you, Dr. Davila, and good afternoon. Over the course of the weekend, we learned of the highest daily COVID-19 infection counts since the outset of the pandemic. This is not the news that any of us wanted to see. We all long for decreasing case counts, less infections, less stress on our healthcare systems, less Toronto businesses being impacted, and most importantly, less lives being impacted and lost to this terrible virus. I feel the same things that each of you feel. I want us to be able to reopen the city. I want to be with family and friends without having to be concerned about physical distancing, masking, or the transmission of COVID-19. I want to be able to meet friends for dinner, shake hands, and be back in person with my colleagues at work. I know that we're all tired of COVID-19. We are frustrated, annoyed, and even angry. In my role as your fire chief, I am no stranger to dealing with emergencies that interrupt and impact life in our city. When we respond to major fires and other emergencies, our #1 priority is always to save lives. We close roads, evacuate buildings, impact both transit and traffic flows, and establish evacuation perimeters, all to reduce the risks associated with the emergency at hand. When those emergencies happen, I stand in front of you and do my best to explain both what is happening and what we are doing about it. I do my best to beg your indulgence and patience as we disrupt the normal cadence of life in our city. I know that situations like major fires are easier to understand than COVID-19. We can both see and understand the risks associated with the smoke and flames from a major fire, and that makes immediate sense to us all. Building an incident management system on this scale and responding to an invisible emergency like COVID-19 is unlike anything any of us have had to do before. We are exhausted by the impacts, tired of the restrictions and closures, and frustrated by how profoundly this is impacting our lives every day. But now, more than ever, I need your help. I need you to make the choice to be part of the solution by following the advice and direction of our doctors. And I ask you to seek out credible sources of information about COVID-19, such as toronto.ca. Now more than ever, we need to stay the course. Our teams are doing their very best as we continue to battle this pandemic. Every single day, we are planning for and responding to this emergency as it evolves. We are working hard to ensure that we have the PPE that our frontline workers need as they work to serve others. And while PPE certainly continues to be a global challenge, we are well prepared. Our critical and essential services continue to be delivered each day. From the outset of COVID-19, our incident management system priorities have remained the very same: to save lives and prevent our healthcare systems from becoming overwhelmed. But we simply can't achieve these goals without you. Every time we avoid gathering, every time we wear a mask, wash our hands, and keep our distance, we save lives. We prevent our hospitals and other healthcare systems from becoming overwhelmed. We protect our long-term care homes, our shelters, and the most vulnerable among us. I know that you're tired, frustrated, and that you've been heavily impacted by COVID-19. I know that because I am too. But we can do this. Together we can beat this virus and get back to all the things that we miss. And until we get there, we will not stop doing all that we can to beat COVID-19. Many times I have stood in front of the media and asked each of you for your patience, understanding, and indulgence as we battle whatever major emergency is occurring at that time. Today, I'm asking you again. And I know that this is a bigger ask than ever before, but we can save lives. We can prevent the spread of COVID-19. We can ensure that our hospitals and other healthcare facilities are able to deliver the world-class care we both need and enjoy. And we can all get back to enjoying our friends and family, our vibrant dining, hospitality, and entertainment venues that Toronto is so famous for, and get back to enjoying each of the activities and services that we so badly crave. Please, follow the advice of our doctors and maintain compliance with the important public health measures that have been put in place. Together, we can minimize the resurgence of COVID-19 in our city. I know this is a big ask, but I also know that we can do this. Thank you.
All right, thank you, Chief Pegg. We have a number of staff on the line to answer any specific questions reporters may have. We go first to Lucas Meyer from News Talk 1010. Lucas, go ahead, please.
Thanks a lot, Brad. So to the mayor and maybe to Dr. DeVille, I know we've asked you this before, but we've gone to the province about this too. It's this whole question around what constitutes indoor dining with all these restaurants investing in pods or camping or yurts, tents, and what have you, and whether that will still be allowed to, especially if the 28 days goes any longer. So perhaps, Mayor, can you just simply break down for us what is proper ventilation, who determines that, and when should restaurant and bar owners get standards on what kind of temporary tents and what have you is allowed and what isn't?
Well, let's be very clear. The Bible on this is the provincial order, and it talks about what indoor space is and how indoor space is to be defined. And while there are discussions going on now because of the ingenuity and different products that are out there that might be used to provide for all seasons patio dining, the Bible has to be, until further notice, the provincial order. I discussed this with the Premier, and our medical people have been talking back and forth about providing some greater clarity. We sent out a communication on at the end of the week that indicated the provincial order said what it said with respect to what proper ventilation is, and so that stands until it's changed. And I'm hopeful, frankly, there'll be some clarification provided just so that there can be even specific examples that can be referred to pursuant to the regulation, but the wording of the regulation has not been changed as of this moment.
Okay, so there should be at least some more coming out later. Thank you for that. And my second question is actually to Chief Pegg. Chief Pegg, the Firefighters Union put out a new audit on their staff today, which says that more than 1 out of 10 fire trucks are out of service due to staff shortages. Does that sound right to you? And if it is, what does the city have to do to address this, considering, winter's coming, you're going to have more people cooking indoors, COVID-19 can certainly put firefighters at home too. How much of a concern is that?
Yeah, thanks, Lucas. So I can tell you that I received a draft of the report that the association released. I received that draft late last week, and I think I'll summarize by saying I'm not necessarily surprised by anything that's contained in it or by any of the findings. To be very candid, what concerns me most is the acknowledgement and the assessment, if you will, by the actuarial firm with respect to the rise and the increase in unplanned absences and the fact that those are on the rise, and most notably, the fact that the leading cause of those absences is in fact both incidental sick time and WSIB-approved illness and injury. And we know that that's increasing, and again, what disturbs me significantly is that the overwhelming, in fact, the majority of those WSIB absences are as a result of things like post-traumatic stress and other occupational stress injuries. I think it's important to note, Lucas, that and never to lose sight of the fact that the City of Toronto provides world-class fire protection services to our residents, our businesses, and every one of the visitors that comes to the city. Industry best practice, and you know this if you've read the report, industry best practice in the form of NFPA 1710 calls for performance levels at the 90th percentile. And important for us to note that in 2019, Toronto Fire Service performed at the 86th and 87th percentile, respectively, across the applicable key performance indicators relating to the response to structure fires. So I would say this, suffice it to say that there are a number of initiatives within the Toronto Fire Service Transformation Plan that include a number of comprehensive deployment reviews, and they are underway. It is unfortunate that some of those reviews had to be paused or delayed as a result of having to reprioritize resources to our response to COVID. I'm thankful that those reviews are back underway now, and ultimately I would say that the combination of those reviews and the content that has been provided by President Ramaniano and the Toronto Professional Firefighters Association is valuable and ultimately will inform future recommendations that I will make to City Council for their consideration with respect to fire protection service on a go-forward basis.
Okay, thank you for that, Chief. We go next to Matt Bingley from Global News. Matt, go ahead.
Hi, good afternoon. Dr. Davila, Ottawa and Toronto both entered this modified stage 2 at the same time. And when you look at how Ottawa is doing in comparison, they appear to have flattened their curve when it comes to new cases where Toronto isn't there yet. Now, the way that the tone that you're taking today with talking directly to people and their actions, I'm just wondering if that is part of the difference in approaches. I guess what I'm just trying to figure out is what are they doing that we are not?
Well, Matt, I think you ask an interesting question, and one for which there isn't a simple answer, unfortunately. I think the circumstances from one jurisdiction to the next are quite different, and each of our cities is its own unique creature, if you will. We're a different city from Ottawa. We have some similarities, clearly. Cities do have some elements in common. And I think that what's really important here is that we know what actually gives rise to virus transmission. And so to the extent that we're able to change those conditions, whether it's through measures taken by local and or provincial government or by individuals, each and every one of us, we know the more we're able to do this together, the more successful we will be in terms of reducing case counts. So we know the conditions that give rise to virus spread. Close contact between people, particularly in indoor circumstances where they're engaging in activities where it's either difficult or impossible to wear a mask or maintain physical distance. So those kinds of activities we've heard about sometimes are about eating and drinking. That may happen in the context of a bar or a restaurant. It may also happen within the context of people's homes. So we know that these are the challenges, and we've all heard the stories of transmission happening in those kinds of settings. We've also heard as of late that the kinds of conditions that happen within fitness facilities, group fitness activities, one particularly well covered by the media that happened just to the west of Toronto. Those are the kinds of circumstances, again, indoor activity where people are together and engaged in an activity where it's either difficult to physically distance or to wear a mask as part of that activity. So I think these are the things that we're all looking to, whether it's in Toronto, Peel, Ottawa, or anywhere else. These are the kinds of actions that you'll see throughout Ontario and frankly throughout the world, because this is what makes a difference to control spread.
Okay, thank you. And just to follow up, just looking forward to the weekend with Halloween coming, you mentioned Thanksgiving as possibly one of the ways that we're seeing some of these cases start to surge. I'm just wondering where it is right now still just a provincial suggestion, not an order not to trick or treat. Should that be a stricter order? Do you think Toronto needs some sort of stronger order in place to prevent people from going out and possibly contributing to this?
You know, I think we have seen what the people of Toronto can do. And, you know, hence the kinds of remarks that I delivered today. You know, we all have to believe that there is the opportunity for something better and have the reasons. Like, I really encourage people in Toronto to think about, you know, what matters to them, who matters to them, and what really is driving their actions. You know, who do they want to protect the most? And what are they willing to do to get there, to get that kind of protection? So I have a lot of faith in the people of Toronto that when they really think about what it is that they want, what kind of city they're hoping to live in, and who they want to protect and what they're willing to do, that they'll make the right choices. We've seen them do it. They did it in the spring, and I have every confidence that the people of Toronto can do it again.
Okay, we go next to Lauren Pelly from CBC News. Lauren, go ahead, please.
Dr. Davila, there's always speculation that the reported case counts we're seeing, including these record-breaking numbers in Ontario, are still underestimating the reality. With the fact that we still have much of our contact tracing on pause, there's a lot of community spread that we're not able to track. You know, what is your take on that? I mean, how big do you think the problem is beyond the official tally?
Yeah, you know, that's a very interesting question, and it's one that's not just asked here, it's asked all over the world. Very difficult to ascertain. Hence, all the more reason for people to actually adopt those actions for self-protection, because we know they work. They've worked here in the spring, they've worked elsewhere, whether it's elsewhere in Ontario, elsewhere in Canada, and elsewhere around the world. The more we're able to really keep our distance, limit our close contact, strictly to those with whom we live. You know, wearing our masks where possible, as much as possible, washing our hands, staying away from others when we're sick. We know that when we do this all together, it actually does make a difference. The actions are really, really simple, and I know you've heard me say it, you heard the chief say it today as well. These are really, really tough things to keep doing day after day after day. We're all tired. But we know that this works, and it will bring us that much closer to the city that we want and the lives that we would like to have back.
And you talked about the ripple effect of Thanksgiving earlier. With Thanksgiving and the restrictions in Toronto falling on the same weekend, what are your thoughts as we go forward over the next days and weeks in terms of, you know, we're at a crossroads. Will we keep seeing cases go up, or will we see them start to drop? When do you think we'll start to know if any of this is making a difference?
Well, clearly we're hoping that we're going to see things turn in a direction that is more favorable, right? A direction that clearly indicates a reduced case count and reduced COVID-19 spread and transmission in the city. I hope that we will see that in the next little while. It does take some time before we see the impacts, as we've discussed several times over the course of the pandemic. The case counts that we're seeing today are a reflection of infections that were acquired 10 to 14 days earlier. So we know that, and again, this is in a situation where you have sort of regular issues with respect to testing. We've had some testing challenges, we've had some turnaround time challenges, and I know that my provincial counterparts who are in charge of testing have been working very hard on those, and it's a heavy lift on their part, no doubt. But we are hoping that in the next, couple of weeks, we should be seeing some of the impacts, not only of the measures that have been taken at the government level in order to try to reduce spread, but also I'm hoping that we're going to see the evidence of the people of Toronto and frankly the people of the entire province to really do their best to engage in those self-protection measures for all of our benefit.
Okay, thank you. We go next to John Chidley-Hill from the Canadian Press. John, go ahead.
Good afternoon. I've got two questions. The first is for Dr. Davila as a follow-up to Lauren's question. How big an impact do you think Thanksgiving gatherings had on the case counts we saw this past weekend and today?
Well, certainly the timing lines up appropriately, given what I've just said, that the case counts that we're seeing, today or in the last couple of days are a reflection of infections that were likely acquired about, 2 weeks ago. So certainly there is likely to be a significant impact there. How significant, I can't say specifically. That's part and parcel of understanding all the cases and the unique circumstances. But we do know from the experiences all over the world that it is that kind of gathering, the gathering of people together, especially within indoor locations and especially engaged in activities where it's either difficult to physical distance or to wear a mask on a regular basis. And it is clearly challenging to wear a mask while you're trying to enjoy a Thanksgiving dinner or a meal with friends and family. These are the kinds of circumstances that give rise to virus transmission, to virus spread, and that actually perpetuate the infection throughout our city. Thanks.
My second question is for Mayor Tory. Mr. Mayor, the Ontario Big City Mayors met on October 15th and made an appeal to the federal and provincial governments for extra funding for infrastructure to help maintain a state of good repair in municipalities. I'm curious, how critical is it for the City of Toronto to get that funding to maintain its infrastructure in 2020 and 2021?
Well, I think that we'd fallen behind over many years, long before a pandemic was even a word that we talked about very much with respect to infrastructure. And with the help of the other governments, we've been slowly catching up. The city itself has been making billions of dollars in investments of infrastructure of all kinds. And it's important. It's important both because it helps connect people to opportunity, and we've seen what happens when you have neighborhoods, for example, that are isolated. It's important in terms of health and safety on things like our water supply and things like that. It's important for the environment. So, I mean, these are crucial dollars as well to make sure that we can come out of the pandemic-induced recession with more jobs. So I actually think the federal government are very engaged on this file in terms of allocating those infrastructure dollars. We've been in extensive discussions with Minister McKenna and others. We got a good news letter last week about a significant project that will help with flood control in the west end of the city, for example. So I'm confident that we're going to get the support we need, but we just need to sort of have more certainty sooner from both governments, and then we'll proceed to put our share forward and get on with these projects, get on with creating the jobs, get on with making the improvements, and get on with building a better city.
Okay, we go next to Sabrina Jonas from CBC News. Sabrina, go ahead, please.
Hi, good afternoon. My question is for Mayor Tory or Dr. Davila. When it comes to larger gatherings that are helping drive COVID numbers higher, why are wedding ceremonies still allowed to have 30% venue capacity here in Toronto? Receptions are capped at 10 people indoors and 25 outdoors, but a 30% capacity in a big Toronto church could push those capacity numbers well above the outdoor maximum.
So Sabrina, when we look at the regulations and the rules around gathering sizes, I think it is important to actually reflect that question back to our provincial counterparts. As the mayor was commenting earlier in this news conference about indoor dining and the regulations that apply there, This is a very similar circumstance. That which is allowed in terms of gathering limits and sizes for different events and venues is actually stipulated in the provincial legislation and the associated regulations. So those are the terms that are currently governing what can happen here in Toronto and elsewhere in the province, and so those are the rules such as they exist.
I'll get myself in some trouble here by saying what I honestly believe to be true, which is that I think we have to take another look at those regulations. And, you know, it was once said to me by somebody in the provincial government that you don't want to mess with the sort of the brides of Ontario or of Toronto, and that's a fair statement, or the grooms. But the fact is that, you know, any large gathering, no matter how careful you are, has a certain risk associated with it, and I guess it kind of depends on the church, and it kind of depends on the ability to space and whether people wear masks and all the things that Dr. DeVille has talked about. But I really think that, you know, we have to look at large gatherings that are permitted, large gatherings, and absolutely ensure that they are being done safely in all cases, or look at changing those rules.
I think that just gets to the point of those circumstances that give rise to COVID-19 transmission, the kinds of comments and the conditions that I've been describing in answers to other questions this afternoon.
Follow-up, Sabrina?
No, thanks so much for this response.
Okay, thank you very much. Final question then is to Francine Copen from the Toronto Star. Francine, go ahead, please.
Oh, hi. My first question is for Mayor Tory. Mayor Tory, did Premier Doug Ford ask you to support the idea of dining pods?
Well, he asked me about the apparent, I guess, confusion that was out there, where on the one hand, some people were led to believe that they were, you know, permissible under the rules, and on the other hand, there were others who were skeptical about that. And so we simply had a discussion about the fact that the provincial order says what it says, and that I think in light of the fact you have the ingenuity of the private sector with bubbles and pods and yurts and so on, and I admire that ingenuity, which I in fact have been encouraging by getting out of the way to say, well, look, we want you to try to find ways in which, and I've always said, it shouldn't be a way in which you create a new kind of indoor space. It has to be something that is outdoor within the context of proper ventilation and so on. And so I think what it outlined or underlined is the need for some clarification. And I think people have been working since then, which was at the end of last week, to provide that clarification so that we can both do what is safe and healthy for people, which is most important, but also at the same time make sure that people don't make investments based on any kind of faulty understanding. And we tried to get some material out on Friday to make sure that we did our best to make sure that you know, we reminded people what the regulation currently says, and it's there on paper, and it exists until it's changed.
My next question is for Dr. Eileen DeVilla. The new measures, or you know, the renewed measures, let's say, have been in place for 2 weeks, and we're continuing to see the number of cases climb. Does that mean they're not working?
No, Francine, I don't think that's necessarily the case. There are a number of reasons for which we may be seeing, for which we're seeing what we're seeing now in respect of numbers. Certainly, the potential for gatherings at Thanksgiving would be one of them. And I think that fundamentally what we are focusing on is what can we all do together? What do we know of the way the virus transmits? How do we actually change those circumstances? How do we prevent those circumstances from arising frequently? And how do we then start to, you know, capture back, you know, as much as possible of our lives by reducing virus spread throughout our city? So I actually think we need to be watching further. It does take some time. The kinds of cases and the case counts we're seeing today are the effects or the result of infections that were acquired about 2 weeks ago. So I think we still have to observe the impacts and really appreciate the impacts of the changes that were made a couple of weeks ago. I don't think we have yet seen the full impact. I look forward to seeing what comes in the next few weeks. And again, I would encourage everyone in Toronto to continue to engage in those steps for self-protection. I know that it is difficult. It is difficult to continue on with them. They are relatively simple actions, and the thing that's really important is that we know that they work.
Okay, that concludes today's briefing. Thanks very much for joining us. We'll be back here on Wednesday afternoon. Have a safe and pleasant evening, everybody.